landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. Friday, June 8th here, 2018. Happy to bring you on an adventure of health in South Florida. You can always find the show on Facebook Live, All County Healthcare Incorporated's page. Just type that in the browser. You'll be able to find the show there. So I'm actually linking to that right now as we speak. And then also on allcountyhealthcare.com, they have all of the past shows as well. So you may remember about a month ago, we had Dr. Mirylsa Martinez on the program. She's an orthopedic surgeon, foot and ankle specialist in Boca Raton. And wanted to have her back on the program because she's been in the news lately. She was with the Palm Beach County Medical Society. There she is on the screen. So, yeah, thank you for coming. How are you doing this evening? Thank you, and thank you for sloshing over in this rain that we've had. It's a good radio day, but, I do appreciate you making it in studio.
Thank you.
What I was talking about, Palm Beach County Medical Society, great group, great organization, I should say. I actually do a lot with them. I went to their Heroes in Medicine event. Outstanding. If anyone has a chance to go to that event, I think it was like 600 people. It was at the Kravis Center, a couple months ago. Just amazing event. But I saw that they were doing this, it's like a talent show for doctors.
Yes.
And then I was thinking, I work with a lot of doctors. I would love to see all the talents. And then you stole the show. You sang on the program. That was June 1st.
Thank you.
How did that come about?
Well, I've been singing for a while. I'd say I stopped after becoming a mom and moving to South Florida, and a lot was going on. So now that my kids are starting to outgrow, the early years, I've gone back to doing the things that I love, which includes singing, of course.
Was that kind of a first hobby or passion?
I
shouldn't call it a hobby, right?
My first love is music, especially
Really?
Dance. Okay. I was a dancer, backup dancer. I did ballet, jazz, and modern dance also, which has been great for me, especially as a doctor to dancers. Ballerinas, ballet, any kind of dancer. I understand how the movements feel in the body. There's a lot of French terminology for dance. All the terms are in French, and not everyone can really understand what a releve or a jeté is, but I do. So as a doctor, having dancers as patients, I think that's ideal for them and for me.
That's fantastic. And, I never thought of that, but there's a lot of ailments or injuries that can happen also in dance,
yes.
As well as, maybe some other sports we don't think about, like cheerleading, which is, mostly a women's sport. There are men cheerleaders too. And I actually read a testimonial once on an orthopedic surgeon, and it was fascinating. It was about a ballet dancer who had an injury and how the orthopedic surgeon helped them. And you're unique because you're an orthopedic surgeon through your training, but also you specialize on the foot and ankle. Correct. Mostly. But let me just release the stigma here. So orthopedic surgeon, you could treat any joint in the body, correct?
Yes, from the neck down.
Okay, the neck down.
Anything that's part of the musculoskeletal system, which includes the bones, joints, tendons, ligaments, muscles, fascia. We're probably better known for fractures, fixing fractures, and for joint replacements. Okay. But we do repair tendons, ligament, cartilage. There's a lot that we do. And not all the patients that we see in the office come in with a fracture. You can come in with pain, and we get to diagnose it and treat it. And as we were talking outside, I like to say that I love the patient with the mystery foot pain.
I was going to ask you about that.
One of the things that I love the most about what I do is diagnosing properly someone. It's like playing detective for me as a doctor. So I love when someone comes in and they have been to, several different providers, and they do not have a diagnosis, and then we can finally find the diagnosis and then head on the right treatment.
That's fantastic. And I did mention foot and ankle specialist, and the reason I wanted to get to that is Dr. Colon is a board-certified orthopedic surgeon and fellow of the American Academy of Orthopedic Surgeons. She completed a foot and ankle fellowship at the Brigham and Women's Hospital in Boston, Massachusetts. If you know anything about teaching hospitals, you know that is an outstanding hospital. It's affiliated with Harvard Medical School people. That is really outstanding. So as I said, specializes in foot and ankle. That's because you did your fellowship. You did extra education and training.
Extra training, yes, correct.
In the foot and ankle. But foot and ankle surgeons, I mean, they regularly treat up the leg as well, sometimes knee issues, sometimes all the way up to the hip. You even mentioned, because you're an orthopedic surgeon, every joint in the body from the neck down. So that's just amazing.
I am, number one, an orthopedic surgeon who subspecializes in foot and ankle surgery, which means that I can treat shoulder problems, back pain problems, neck problems, knee injuries or problems, anything in the musculoskeletal system, which is different from other foot and ankle specialists. Everyone has their own, their own area of specialty, but I have the training to treat anything from the neck down.
And even that, like you said, mystery foot pain, which I've actually had in my life for a little while, so it may be coming your way to see you. I know I said that last time, but definitely will. We talked a little bit in the green room about plantar fasciitis. Is that something that you can the general public can go to a foot and ankle surgeon?
Yes, definitely.
Because it's not always surgery, right? Sometimes it's being put on a program of stretching and rehab and that kind of thing, sports medicine in a way.
Plantar fasciitis is probably the most common or one of the most common reasons why patients seek care with us. Approximately 1 in every 10 people will experience heel pain in their lifetime. So it is very common, but not all heel pain is plantar fasciitis. The differential diagnosis is broad. You have to listen to the patient and ask the right questions to get to the proper diagnosis. Then with the examination and the testing, then you can get to the proper diagnosis. Plantar fasciitis, I typically treat, once it's diagnosed as plantar fasciitis, I typically treat with stretching, insoles, anti-inflammatory, and sometimes an injection. However, now there is regenerative medicine, which we can use to help that tissue heal. And a lot of people will say, I have a bone spur. Yes, we can see that on the x-ray, but so do a lot of millions of people have bone spurs and don't have pain. So far, the data is telling us that the pain is coming from the tissue that was inflamed once and now degenerated, and that causes pain. So we treat the tissue with stretching and comfort measures, and now we have regenerative medicine to help that as well.
And that can be treated without surgery.
Without surgery.
In some cases, I should say.
Done very few plantar fascia releases. I have seen patients who have scarring from previous surgeries, and the scar is forever, and the scar hurts even more than the plantar fasciitis itself. So I try to avoid surgery as much as I can, especially for plantar fasciitis. There's another surgery which you can do up in the leg that will release the plantar fascia indirectly, and that is also shown to give good results. But I try to stay away from surgery for plantar fasciitis especially.
Let me ask you, if someone's walking around and they have that pain, is it something that they should just kind of put on the back burner for a little while, or take the time to go and see an orthopedic surgeon or specialist like yourself? And then also, is that, like, could it get worse? That's what I'm saying, over time, if you don't get it managed, if you don't get it treated?
Yes. Anything that you don't treat has the potential to get worse. You want to seek care as soon as possible. And we offer appointments the same day. So, and we accept most of the insurances. So yes, I would say go see your doctor as soon as possible. And
you were mentioning your office there. So tell me a little bit about your office. You're new to the Boca Raton area, and tell me a little bit about your office, and then kind of take me into your office, take me into the waiting room, take me into the office, if you would kind of like make it like a virtual for the listeners.
Okay. So my office, I like to say it's almost like a spa ambiance. You come in, and there's aromatherapy. There's light jazz or Brazilian music playing in the waiting room. It's very, very, very modern. All the furniture, the floors, the lighting, everything is very modern. We have a lot of wall art with positive messages. We have 4 treatment rooms and an office. I just want to make patients experience something different, come in and feel like they're taking a vacation when they come into my office.
Mm-hmm.
You know, I don't have a TV, so I want you to disconnect a little bit, wind down and unwind from your, hectic lifestyle, and connect with me and connect with yourself and the experience while you're there.
Maybe get away from all that stimulation that's going on with you may have heard the ambient noise of my phone there I forgot to turn off. Or, like you said before when we were talking, driving around, the flashing billboards. That one on 95 going north or south through Lake Worth always gets me. It's flashing, and it's the newer one with the more electronic, and it always gets me. I know you're not supposed to look at it when you're driving, but it always stimulates me, and I'm like, man, I didn't want to look at that.
We are always overstimulated. The whole system, the world is overstimulating us. You're looking at the billboard and you're driving and there's traffic and you're looking at your cell phone and then you get a phone call and then an email and it's nonstop. So I want the people who come into my office to stop for a minute and unwind and get some wellness, some of that wellness experience about being in the present moment and connecting to yourself and to me, which is what I love.
Nice. Well, I want to get on over there just to check out that office, and I will. And you're also on staff at West Boca Medical Center, correct? The hospital?
West Boca Medical Center.
Okay, so your office is right near West Boca Medical Center as well?
Yes, it's in their campus.
Okay, and then if it does get to a point, an ailment that does need surgery, you do your orthopedic surgery there at West Boca Medical Center?
Yes, all my surgeries I do in the hospital.
Okay.
In an operating room. I do not do surgery in my office. The most invasive that I will do in my office is an injection or an aspiration of a joint, for example. But I don't do surgery in my office. It's all in the hospital. We
got about 2 minutes till we take a break, a little commercial break. But I wanted to ask you, before we go deep into the areas of interest and some of the more technical stuff, there's a chance to see your office in the near future here. For the public can come by for a Botox and Bubbles event. Tell us a little bit about that. Is that June 21st?
June 21st, 5 to 7 o'clock at night, 5 p.m. to 7 p.m.
Okay, so this is a chance to meet you, see the office, see that really, really neat office you described, and then also a chance for some cosmetic in a way.
Yeah, I also do some cosmetic treatments in the office, and this will be a good chance to bring in people to see the space and experience that. We're also going to have Tiffany. Hi, Tiffany, who's my
Tiffany.
Massage therapist. She's there on Mondays. She does everything from hot stones to deep tissue to Reiki. She's amazing.
In your office?
In my office on Mondays, yes. And she will be there giving free chair massage for the event.
Okay. And again, that's 5 to 7 on June 21st?
June 21st.
Okay, fantastic. We'll have to get over there and take a look at the office. That'd be a good reason for me to stop by, get a massage, see the office, and then I can make an appointment for you
get your foot checked.
This ailing right foot, which I know has something to do with the metatarsal from my last time I tried to play basketball. And Freddie can come by, and he can get some Botox as well. He's our radio producer, so that'll be great as well. No, we'll tell everyone about it. No, it's a good chance to get in there and take a look at your office, and love champagne as well. So if you have any flowing, that'd be great. We're going to take a quick break, and then on the other side, I want to get a little more technical on some of the things you do, like fusion surgery, because that's always interesting to explain on the How to Stay Healthy show. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hello, South Florida, and welcome back to the How to Stay Healthy show. We're here with Dr. Cologne Martinez. She was telling us about her new office right next to West Boca Medical Center there in Boca Raton. And before the break, I wanted to ask Dr. Cologne Martinez a little bit about fusion surgery. If you could explain it. I've heard it explained by you for the foot and ankle, and then I think it's also used by a lot of spine surgeons as well, right?
Yes, correct.
Tell us a little bit about fusion surgery.
Fusion surgery is a very viable alternative when you have arthritis in a joint or when you need to stabilize an area, for example, in the spine. In the foot and ankle, it's used most commonly when you have arthritis in a joint.
Okay.
And that joint is not a candidate for a replacement for some reason.
Okay. So that's when fusion surgery can be a possibility.
Right. You don't hear about fusion surgery of the knee
No.
or the hip.
No.
But it was done in the past before the joint replacements became more successful and the implants had better survival rates. So in the foot and ankle, we replace the ankle joint and the first MP joint and some of the other small joints, but some of these implants are still we're still studying them. Mm-hmm. The ankle replacement has provided excellent results, but not everyone is a candidate for an ankle replacement if they have arthritis.
Mm-hmm. Hypothetically, I have fusion surgery. How long am I in the hospital? What's normal recovery time? I know everyone's different.
So what happens during fusion surgery, many of these patients have already lost the motion in the joint, but the joint is painful. Mm-hmm. So what we do with fusion surgery, we get into the joint, we scrape out all the cartilage and do multiple perforations in the bone, align the joint in a position that allows the patient to walk properly, and then fix the joint with screws or plates.
Okay.
This will decrease the motion, right? Like when you do an ankle joint, you lose 75% of the motion. You still have some up and down motion, but it will get rid of the pain. It's either an outpatient or one night stay in the hospital, and the recovery process depends on the implant. Some implants now you can walk on them almost immediately. It used to be 3 months in a cast, 6 weeks non-weight bearing, and the other 6 weeks weight bearing. But now some of these implants are so amazing that we have available now that you can walk on them almost right away.
Yeah, so if you have arthritis, don't be scared of being out of, quality of life or work too long, because as we talk about on the show all the time, surgery and medical technology is just moving so rapidly. It's great for the patient, and especially you do minimally invasive surgery, so that's great as well.
It is.
Let me ask you also about, since we're getting a little technical here, an acronym AVN. What is that, and how can that help?
AVN stands for Avascular Necrosis. Avascular means no vascularity, no circulation, poor blood circulation in the area. Necrosis means death of the tissue. So this is a condition which is rare, but it's very disabling. And when you have it, it means your bone is dead or partially dead from lack of circulation. That creates arthritis, pain, disability, sharp shooting pains, difficulty walking. And it can happen in the ankle joint, in other bones in the ankle. It also happens in the hip and other bones.
I didn't know that. Learned something new.
Some of the risk factors for AVN or avascular necrosis are smoking, older age, older than 50, 60, chronic use of steroids, autoimmune diseases, and these medications, and trauma can also be a cause of AVN, avascular necrosis. And the reason why I want to talk about this is because now, when I trained 10 years ago in Boston, what we used to do with these cases was do a fusion. We had to take the bone out and put another cadaver donor allograft bone in the space and do a fusion. But now we have 3D printed implants of the whole bone. So you can keep your motion and your quality of life and not have the pain from the AVN.
I'm smiling because there's that medical technology. And you made me look smart there. So
3D
thank
printing.
you.
3D printing. It's amazing.
3D printing. It's here. We heard about it, and it's already being used in the medical field right here in South Florida and West Boca, Boca Raton, I should say. That's fantastic. That's why we like to have doctors on this program because, who else would know that if you weren't tuning in? You do, your patients do, but we're reaching internationally with this show. That's great. So last time I had you on the program, we talked a little bit about bunions, and I started the program because I've read a lot on this topic, researching foot and ankle, and I hear bunions sometimes are caused by high heels, but you're not going to get some women to quit wearing high heels.
I know.
But on my side, bunions can happen to men too, as well. It's not just women from wearing high heels, right? Tell me a little bit about bunions and what kind of treatments are available today.
So bunions have been reported even in civilizations who don't wear shoes.
Oh, okay.
So it's not exactly shoe-related. Shoes can exacerbate the condition, or if your foot is prone to developing bunions because of your intrinsic anatomy, the way your foot is, then and you wear the wrong shoe, you can then develop a bunion, which is that bump or lump that you get in the front of your foot on the inside of your big toe, and then the toe goes out to the side. That's what we call a bunion. We can treat it. First of all, the treatment is shoe modification, activity modification. There are several ways in which we can modify shoes with stretchers, etc. And when everything else has failed, we can do surgery, which typically has been fully open surgery. Open up, dissect the area, cut the bone, shift it over, fix it with screws. Now we can do all that percutaneously with 2-3 millimeter wounds, literally a stab wound. We have now available here in South Florida and recently approved by the FDA these instruments that allow the bone to be cut through a stab wound. So it's like a drill bit, but it cuts sideways like a saw.
And those actually, those kind of types of cuts heal much quicker, less infection because they're very, you said percutaneous, they're very minimally invasive.
Much less pain too.
Oh, that's great to hear as well because, bunions, luckily I've never had one, but it's great to know that you have an option like that because it sounds like something, I wouldn't want, to take the next step to get it treated, but that's great news as well. And it's not always the shoe. I never heard that, so that's great to know.
It's, if you wear the high heel shoes and the toe box, the space where the toes fit is super tight, and you have a prone foot for that, then you can develop a bunion. Over time, you will notice it. But some people, like you said, some men, and I've done surgery on men with bunions, and they don't wear high heels.
Now, if you want to check out any of the areas of interest of Dr. Clone Martinez, great website you have, ton of info. That's where I got my info. OrthoWellnessMD.com. You can also get the phone number for your office. I know it's a 954 number, so I want to give it out.
Yes, it's a 954-251-6051.
And then you're always available email as well to check orthowellnessmd@gmail.com.
Yes.
As well. So I saw your Monday through Thursday you have pretty normal hours, and then Friday you half a day?
I'm half a day because I save that afternoon for the aesthetics part of what I do.
Okay. Fantastic. That's great. Well, I really, and I'm happy you came back to the program. I think we have a couple more minutes, so I want to talk on a couple different things that we maybe got to last time. Okay, 2 minutes. It's the lightning round. Here we go. So trigger point injections, are those done in the office or is that hospital?
No, we can do in the office. It's an injection that goes to the muscle to stimulate blood flow in the muscle and help with the pain. When you have a muscle spasm, we can do that safely in the office.
Now, do you do PRP, because platelet-rich plasma, did I get it right?
Yes, we do PRP, platelet-rich plasma, for orthopedics and for aesthetics, too. The uses for aesthetics are many. It's used almost as a filler, basically. For under eye,
you have a lot of expertise in this, because you've been doing this a little, it hasn't been around too long, but a few years.
Yeah, but with PRP, I have a fair amount of experience.
Oh.
We also do amnioplacental tissue matrix injections, which are great for plantar fasciitis, Achilles problems, and any tendinosis. This is really, really good.
You know what I'm seeing from this interview? You have so many different options to treat the patient. Maybe, maybe they have to have surgery, but if not, there's all these other options, and that's what's great. You have like a huge toolbox available.
Exactly. That is what I wanted to achieve with this practice, because most people are scared of undergoing surgery, and I am not one to push surgery on someone who's not ready. So I'm happy to be able to offer all these different treatments to make them feel better.
That's great. And a fellowship-trained orthopedic surgeon from Harvard. Why not? That's as good as it gets. Thank you for coming back on the program, Dr. Clone Martinez. And check her out at the new office in the Botox and Bubbles, June 21st, 5 to 7.
Yeah, come join us.
Thank you. Thanks for listening to the How to Stay Healthy show. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.